I'm only having mild incontinence, so I don't think I need pelvic floor physical therapy. Hi, welcome to our Ed Talks, little snippets of education to help you heal and feel empowered. Hi, I'm Justine Calderwood, pelvic floor physical therapist and certified birth healing practitioner. I want to talk about this because there's this misconception that maybe mild incontinence, I'm just leaking a little bit, is not really that bad, and it's not a problem that needs to be um, addressed or paid attention to, because it's different than having, say, a full-on accident. And I get it, why this may not be concerning to you if you're just dribbling a little bit, or if occasionally you're leaking with certain things like maybe a big cough or sneeze, um, versus if you have to change your clothing quite often because you're having full on incontinence episodes. However, what I want to say as a pelvic floor physical therapist is that any type of incontinence is incontinence. So whether you're dribbling or you're having fallen accidents and having to change your clothing, it's still a dysfunction of your pelvic floor muscles. They're not working the way that they need to. I'd like to use this little model here to talk about this. Now, I'm talking about urinary incontinence, but just as well, we could be talking about fecal incontinence or even incontinence of gas. Okay, so I'm going to show you here the female pelvis. So to kind of orient you here, if you were to put your hand on your hip, so to speak, you would be landing here at the top of the pelvis. So I'm going to flip this over and kind of show you the pelvic floor muscles. So I want to show you this model, and I'm going to show you from below here. So you can kind of see the labia. This is a female model, of course. You can see the labia here around the vaginal entrance. So we have the vagina here, and then we have the urethra here, which is where we actually urinate out of. So we have the vaginal opening, and then we have the rectum down here. So there are muscles that cause sphincter control, or the the ability to contract down and keep any liquids or gas from coming out of those holes, right? And they also need to be able to relax when it is time to go to the bathroom, time to pass gas. So we do definitely want those muscles to be able to go through their full range of motion, where they contract and close down and also relax and open up. So pelvic floor dysfunction is really these muscles. Part of pelvic floor dysfunction is these muscles not being able to work the way that they need to, maybe going through that full range of motion of relaxation and contraction. Okay, so when we have something like maybe a cough or a sneeze or laugh, that's a sudden increase in pressure, and we want those sphincters to be able to hold back the flow of urine, right? But sometimes you get a little bit of dribbling and you don't have that good sphincter control. Again, that's a sign that your pelvic floor muscles aren't doing the job that they're intended to do. So I'm going to use this balloon as a little bit of kind of a model, right? Let's imagine this is your bladder and it's full of urine. And here at the opening, we have good muscles surrounding that urethra, and it's stopping the flow of any urine out. So mild incontinence, so to speak, would be just a little bit of opening up, right? And some urine is able to leak out, versus a full-on incontinence episode where you have to change your clothing. It's still a dysfunction that's going on. And like I said earlier, this could easily be happening for bowel function. So maybe a little bit of smearing in your underwear, or having to wipe and wipe, versus having a full-on accident in your underwear. And the same thing can happen with loss of gas. So, tooting when you don't mean to be tooting, whether it's just a little sneaks out and it's kind of silent, versus, making noise and having it on a bigger scale. Okay. So you may be thinking, oh, this only happens during pregnancy or after you've had a baby. And I'm here to tell you, this can happen at any time during your life. It can happen without being pregnant or prior to any pregnancy happening. It can happen during pregnancy and also after pregnancy, and then as you age. So while this can be a common occurrence, of course, during pregnancy or postpartum phases, and if you're sitting there right now and you're listening to this and you're thinking, well, I'm pregnant, this is happening, and I just expected this. I was told that that's normal. Um, while it's very common, it doesn't have to be normal. It is something that we can still fix and address, and you can learn how to manage this and improve this even during pregnancy, even with that growing uterus, okay? If you're experiencing this, regardless of the time of your life or whether you're pregnant or you've had babies, I want you to just know that this is a sign of pelvic floor dysfunction. And I want to give you some hope that things can change, things can improve if you seek out some help with this. If you are pregnant, it is even a sign to get this looked at now to help you have a smoother pregnancy and also a smoother birth, because those pelvic floor muscles are going to have to lengthen and allow the passage of the baby. So if you're already showing signs of some dysfunction in the pelvic floor muscles, I urge you to seek out some help. So you may be wondering, what do I do from here, Justine? I need help. What do I do? I'd be happy to talk to you here at the Healing Spot Physical Therapy. Let's sit down for a discovery session and love to answer any questions that you have. Talk about how physical therapy can help you to reach the goals you have, whether that be to have a smoother pregnancy, a smoother birth, to recover fully after pregnancy, or maybe you just want to stay clean and dry. Okay. Head to my website, healingspotpt.com, and thank you for watching this Ed Talk.